what you had on that tooth was a large filling like that fell out. We have what we call a space that forms between the filling and the tooth that permits to infiltrate saliva, bacteria, etc. that forms decay. In our case here, that decay moved in deeper and deeper and deeper over the years without pain. And some patients, when it gets to the nerve, they're in pain, but some they're not. So eventually in our cases right here, the nerve dies away, eventually infects and can lead and turn into an abscess. So what we do, the first step is once we get to filling this deep, we can't just do another filling. We have to take care of the nerve that's been infected by the bacteria and by the decay that you see right here, okay? So what we do is once we clean out all this cavity completely, not only that we have a much bigger gap in the tooth to deal with, but we also get to, as you can see here, the nerve part. So in that case, that's what Gail was referring to. We will clean away the infected nerve, disinfect all the space of the nerve inside, and fill it with a special sealer that replaces your nerve. Okay? Sounds good? So that sealer will prevent any further bacteria or infection to get in there. At that point, we've dealt with the nerve part. Okay? As you're referring to simply doing another filling, if we put another filling on the tooth, we will end up with something about this big, let's just say. Maybe 50% bigger than what we had previously, right?
Right.
All right. So in this case, what happens is when we're going to go home and work on it and eat on it, these thin parts of the teeth are going to eventually take a lot of stress, okay? So when we go and chew on it, the biting force of the upper jaw is going to hit on this side and may cause another fracture. See, we've already had one fracture here, right?
Correct.
Now, if we look right here, this fracture is right to the gum level. So imagine if I fill it again and we get another fracture, it may go under your gum level.
That's no good.
Yeah, so it kind of break on the root right there. Then the tooth is most probably done, right? So we want to try to avoid that. So what we do, instead of just doing another filling, we replace this filling by a very strong material, and we shave the tooth down slightly in order to receive what we call a zirconia crown, a much stronger crown, right? So what we do is we shave the tooth down a little bit, and we will fabricate what we call a crown, like you were referring to. Now that crown is a complete covering over your tooth.
Okay.
Everything is inside, it's protected, and when you eat on it and chew with the upper tooth, you're not hitting on one edge. Like if you remember in the animation before, you're actually hitting and protecting it and balancing the forces everywhere on the tooth.
So it's much stronger than a filling.
Yeah, absolutely. In this scenario, it's much stronger and much more resistant than a filling. You got it.